Perform hand hygiene. With sterile technique, always scrub at minimum for 30 seconds. Rinse while holding your hands in a downward motion. Make sure you rinse all surfaces of your hands. Dry with a clean paper towel, and always grab a clean paper towel after drying to turn off the faucets. Congratulations, you've completed hand hygiene. Obtain equipment. Central line dressing kit or tray. You'll want your Huber needle, sterile sodium chloride, and this is for a sterile field, an 18 gauge needle, and always access using 10 cc syringes. Never use anything less than a 10 cc syringe. If you're drawing blood, you will need a transfer safety device as well as a blood tube. Heparin comes already pre-mixed. If you look, always pull a new central line catheter comparison sheet. It will tell you that Port-a-cath is flushed with 500 units and it is pre-mixed from the pharmacy. So you'll draw up 1 cc for 100 units, so it comes pre-mixed in 5 cc's. After hand hygiene, go ahead and open all your sterile packs. Be careful not to contaminate any of the products. Accessing the Port-a-cath. First, put on your mask. This prevents you from putting germs or blowing germs onto the Port-a-cath site. Everyone carries different kind of bugs up their nose, and we don't want that to be spread upon the patient. Next, perform hand hygiene. Always perform hand hygiene before applying sterile gloves. Apply sterile gloves. If you break sterile technique, that's okay. Just go get another pair of gloves, hand hygiene, and apply the gloves. Note that Stephanie's gloves did not go on completely. She'll fix that after she gets her other gloves on. Do not contaminate your gloves. sterile gloves. Reach underneath the pack and pull out the ChloraPrep. You are always going to prep and clean your patient prior to dressing them. This is your ChloraPrep. Snap. ChloraPrep scrub is going to be for at least 30 seconds. Start at the insertion site and scrub. Time using a clock. Use circular motions and proceed to an outward motion. Make sure that you're covering a good portion of this. After we allow the ChloraPrep to dry, we're going to drape. Also, you're cleaning a large amount of area because this is going to allow the dressing, the central line dressing, to adhere better. And thus you'll have a more secure port. Next, drape after the ChloraPrep dries. Make sure when you begin the process that you always have the patient turn their head. If the patient is unable to turn their head or they're non-compliant, please put a mask on that patient. If the patient has a cold or an infection in their upper airway, please go ahead and mask that patient. Prep your Port-a-cath needle. Obtain your Port-a-cath needle using sterile technique. You're going to attach it to the sterile flush, and you're going to flush normal saline through. You never want to insert a Port-a-cath that has air in it. You don't want to take the risk that you're going to shoot air into a central line. Make sure you break the seal of any syringe that you use. There's an inherent pressure in that, and you don't want to put that into the line. It only takes a little bit. On the initial one, you want to go ahead and shoot a little bit more out because you're going to be inserting this into the chest, and you're going to have a little bit of room to pull back to see if you can draw blood. Accessing the Port-a-cath. Your patient is draped, his head is turned to the side, and now you are going to access the Port-a-cath. The side is cleaned, you are draped. You're going to do a 90-degree angle. There are no angles in this particular. It's a straight up and down access. Go ahead and palpate your site. You can use 2 fingers or 3 fingers to palpate and hold the Port-a-cath so you know exactly where to go. You want to go directly in the middle at a 90-degree angle.
Here we go.
Always warn your patient prior to sticking them so that they know it's coming. You want to unlock your line, and then you're going to pull back. And you're going to look for a blood flash. It doesn't have to fill up the syringe. You just need to see a little bit in the Port-a-cath line. There we go. Great blood return at this particular point. Because we're going to draw blood, we are not going to flush at this point. Obtaining blood from a Port-a-cath. Always clamp your tubing prior to disconnecting. The next thing we're going to do is take off the syringe with a sterile saline, and we're going to discard. If you have an assistant, this is great. If you don't, then you will have your supplies laid out, and you are going to get a 10cc syringe, and you're going to break the seal prior to connecting. Connect. Next thing you're going to do is draw the blood. You're going to waste 5 cc's. If it's been infusing any kind of solution, then you want to waste 10 cc's. Always look at the dynamics of your patient. If your patient is severely anemic, you'll want to hold those fluids for 30 minutes or so, and then, or 15 minutes or so, and then you would want to waste 5 cc's. For children, we're going to instill that blood back if you have not contaminated it. If your patient is severely anemic, we may give the blood back as well. as long as the blood has not been contaminated or is clotted, of course. Okay, discard the waste. Next, obtain the blood for labs. Maintain your sterile technique. Always break your seals prior to connecting. Unclamp and withdraw. Mr. Jackie has a wonderful Port-a-cath that stands right on the top of his chest and always draws black blood. Jackie, how long have you had your Port-a-cath?
About 2002, I think.
Jackie's had his Port-a-cath since 2002. We'll want to withdraw 10 cc's or enough blood to fill up your tubing. If blood does not draw back, sometimes you'll have to reposition your patient. Slowly get them to elevate their arm around their head. Once in a blue moon, we have to turn them onto their side. If you have any problems or difficulty, contact your charge nurse or infection control or education. Always use a transfer device when transferring the blood from the syringe to the blood tube. Safety, it always comes first. Flushing the Port-a-cath. Obtain your sterile saline that you've already got laid out. Make sure you break the pressure in the syringe prior to accessing. Get all the air out as well. Never put liquids on your sterile field. Unclamp and instill. The syringe should push smoothly and evenly. If you have difficulty, stop and go get help. Never force fluid into a Port-a-cath. You don't want to break loose some type of clot. If you've drawn blood back, it shouldn't happen. But all Port-a-caths develop some type of biofilm, as any central line does. Always clamp between changes. Always pull your most current central line comparison sheet. After blood draw, you are going to instill 20 cc's of sterile saline prior to instilling your heparin. Always make sure you break the pressure in any syringe that you attach to a central line. Never use anything less than a 10 cc syringe on a central line. The pressure's too great and we don't want to break the line or damage the line in the process.
You doing okay?
After we instill the sterile saline, we're going to attach an 18 gauge needle and we are going to withdraw our heparin using sterile technique. If you have an assistant, this certainly goes by quicker and much easier. Obtain a sterile syringe and apply your 18 gauge needle. Break the pressure in the syringe. Next, you're going to obtain your heparin. Remember, you have a central sterile field, so you can lay your line on that field. Instill your air. The person who's holding the heparin does not move. It is the person who is obtaining the heparin that moves. Evelyn, tilt your hand down. If you don't tip the heparin down, you will not be able to obtain it. The person holding the heparin does not move. The person in control is the one with the needle. The heparin comes pre-mixed. It's 5 cc's. It's 100 units per cc. Please always check your the latest central line comparison sheet because things do change. Now you're going to discard, activate your safety mechanism on the 18 gauge needle, discard that needle because we have a needleless system, and you're going to attach the heparin to the Port-a-cath line. Instill your heparin. Unclamp. Inquire that your patient is doing well.
You done okay?
Mm-hmm.
That's the last bit.
Now you are complete. Go ahead and clamp. You want to make sure you know your safety mechanisms on all your product. Lay your syringe down. You're going to grip your wings and you're going to pull down the sheath to the Port-a-cath. This is going to activate your safety mechanism. Pull straight up and you will feel a click and you know you're out. Hence, you have removed your Huber needle. Apply pressure with the sterile 2x2 that's inside your kit. And then once you hold for a few minutes and the blood has stopped, go ahead and apply a Band-Aid and your patient's ready to go home. If the patient was going to be admitted, of course, you would leave the line in, you would apply the bio patch and the central line dressing kit. Congratulations, you've passed.